Would you trust a private company or the government with your biometric data? Oh, hello. Welcome to Rapid Nurse. Who am I? Just a nurse with years of nursing experience, making me a nurse of all trades. But a master of nothing. These rapid experiences in the healthcare field took a fresh-faced young person with boundless hopes for our healthcare, and then mutated it into an old, tired, jaded nurse. On the channel, we will discuss topics that affect our healthcare. Now, without further interruption, on to the video. Did you know that a single hospital visit could forever change how you're viewed by insurers and employers? In today's video, we'll reveal how the seemingly benign action of scanning your fingerprints or eyes at the doctor's office is part of a larger, more concerning trend. Discover the hidden side of centralized biometric data in healthcare, a reality where your most personal information could decide your future without your consent. Stay with us as we delve into this critical issue. First, a message from our video sponsor, Amazon. Say hello to the ultimate partnership that's about to change your online shopping experience forever. Amazon and Rapid Nurse have teamed up to bring you the best healthcare solutions, resources, and products right at your fingertips. And the best part? You can use that special Amazon affiliate link to support Rapid Nurse and shop till your heart's content. So, what are you waiting for? Let's dive into this amazing collaboration between Amazon and Rapid Nurse. First off, let's talk about our fantastic partnership between Amazon and Rapid Nurse. By joining forces, we can ensure that viewers like you get the best entertaining items and products at the click of a button. Use the link and order Resident Evil on DVD or Blu-ray. We are beyond thrilled to be working with Amazon. With their vast resource library, lightning fast delivery services, and customer-centric approach, it's an incredible opportunity for us to efficiently support our user community. Plus, we are both dedicated to ensuring the highest quality products and expert advice to help improve everyone's health and well-being. Now, let's talk about the amazing Amazon affiliate link that's now available for you to use. Here's a rundown of the goodies you'll get when using the Amazon affiliate link. Expert advice, guides, and educational resources to help you improve your health and well-being. Access to top-quality, tested, and certified healthcare products directly shipped to your doorstep. Or if you are looking for a laugh, why not order The Office, the complete series on DVD or Blu-ray? You will have the opportunity to support Rapid Nurse by doing something as simple as shopping on Amazon. We are committed to delivering exceptional customer experiences, and our partnership with Rapid Nurse is an integral part of that commitment. With this collaboration, we will be able to make healthcare resources more accessible, engaging, and intuitive than ever before. When you combine the online shopping giant, Amazon, with the healthcare guru, Rapid Nurse, you get a partnership that's as smooth as bannock bread. Together, they're flipping the pages of healthcare, making it as easy as ABC. And hey, while we're at it, don't worry about Amazon and Rapid Nurse abusing data collection. They're as gentle as sterile gloves and as trustworthy as a manual blood pressure check. They'll never ask for your biometric data. That's as absurd as a single-use oral rectal thermometer. All right, enough talking. It's time for you to use the Amazon affiliate link and help change the world for the better, starting with ordering Demolition Man and House of 1000 Corpses on DVD or Blu-ray. So don't wait. Click it, use it, and start your journey to a healthier, happier you. Let's start off by understanding exactly what we mean by biometric data. When you visit a doctor or any healthcare provider, you might be asked for more than just your medical history or symptoms. Biometric data includes unique physical characteristics that can be used to identify you. This might be as simple as a fingerprint, a scan of your retina, or even your DNA sequence. I have seen the employers of some of these private nursing homes install biometric scanners to track their staff. The one I worked at had a thumbprint scanner, which I refused to use to my employer's anger. Why are you getting mad? Is it because you are not getting that 0.5% bonus from my biometric data that you're selling to a shady third-party affiliate? But why is this important in healthcare? Well, These identifiers are incredibly precise. They are used not just for identification, but also to tailor medical treatment specifically to you, thanks to their accuracy in highlighting your unique genetic markers and health predispositions. However, this precision is a double-edged scalpel. While it can significantly enhance personalized medicine, making treatments more effective and timely, it also raises big questions about privacy and security. How is this sensitive data stored? Who can access it? And what happens if it falls into the wrong hands? These are some of the critical concerns we will explore as we dive deeper. Now that we know what biometric data is, let's see how it's being handled. Traditionally, healthcare facilities kept separate records, each one siloed within its own system. But there's a big shift happening towards centralization, where all this data is collected and stored in one place. Now, why the need to centralize? Well, imagine having a complete medical profile accessible with just a click, no matter which doctor or hospital you visit. Central databases make this possible. They connect dots across various healthcare providers, allowing for quicker access to your medical history, test results, and more. This doesn't just save time. It can save lives by providing immediate access to critical medical information in emergencies. On the surface, this would be a great idea. I can't tell you how many times I've asked a patient for a health history, just to have them tell me a long-winded story about how they saw a doctor in a clinic in a province back east, and to have them sarcastically say to me, "Why don't you just get those records?" I don't have access to that database. It is out of the health authority's jurisdiction. Centralization also means more streamlined patient care, with all data in one place. Healthcare providers can more easily coordinate treatments, manage chronic conditions more efficiently, and even reduce duplicate tests, cutting down on unnecessary costs and hassle for patients. So, it makes sense that centralizing biometric data can make healthcare more efficient. Here's a critical question. What about your privacy? Storing all this sensitive information in one place might sound like a treasure trove for efficiency, but it's also a goldmine for potential breaches. Think about it this way. If a hacker breaks into a decentralized system, they might access the information of a few individuals. But breach a centralized database? They could potentially download the biometric data of millions. Remember the 2017 incident with a major credit bureau, where sensitive information of about 143 million people was compromised? Now imagine that scale of a breach, but with your DNA information, fingerprints, or even your retinal scans. While the idea of a hacker stealing our data is chilling, there's another, perhaps more insidious risk: the misuse of our biometric data by those who are legitimately supposed to access it. Imagine a scenario where insurance companies access your genetic information to adjust your rates or deny coverage based on a predisposition to certain diseases. Not so far-fetched, right? Or consider the world of employment. Employers could potentially screen candidates based on their biometric health profiles, leading to a new form of discrimination. These aren't just paranoid fantasies. This one privately owned long-term care facility I worked at started to use facial recognition scanners for staff, to use to sign in and to sign out of work. Talk about another level of control that employers have over their employees. After you no longer work there, your former employer will always have a picture of you. I'm glad I quit before they forced me to use it. There are real cases in other sectors where personal data has been used to track, target, and discriminate against individuals. For example, data from social media has been used to influence voting behavior and even deny loans. Even more concerning are stories like that of a school in Sweden, which experimented with facial recognition to monitor student attendance without proper consent, leading to significant fines under GDPR for privacy violations. These examples aren't merely hypotheticals but real warnings. They spotlight the dual edge of biometric data in healthcare. While it can enhance care, it also poses significant risks if misused. Moving on to the rules and ethics around biometric data. How well are we protected? Laws try to keep our data safe, but they have to keep up with fast-moving technology. For example, in Europe, the GDPR helps protect personal information by letting people control their own data and by setting tough penalties if companies mess up. However, these laws can't catch everything, especially as new tech keeps popping up. In the US, we have HIPAA, which was made before many modern digital technologies were even invented. This means it doesn't fully cover all the ways biometric data is used today, like for advanced research or new medical technologies. The ethical challenges are just as daunting. For example, should consent for collecting biometric data be a one-time event or an ongoing process? How do we ensure that patients truly understand what they're consenting to? We're at a crossroads, trying to balance innovation in healthcare with the fundamental rights of individuals. Amidst these challenges, there's a silver lining: technology itself. Innovations in encryption and blockchain are stepping up as gatekeepers of biometric data. For instance, blockchain technology offers a decentralized security framework. Each transaction or data entry is recorded in a block and distributed across a network of computers. This means no single entity has control, significantly reducing the risk of mass breaches. Encryption methods are also evolving. Advanced encryption standards that were once only military grade are now securing our personal health data. These tools scramble the data into a format that's unreadable without a specific cryptographic key. But technology isn't foolproof. The 2018 incident where a popular fitness tracker exposed the locations of secret military bases reminds us that the misuse of even anonymized data can have unforeseen consequences. We must tread carefully, balancing the potential of these innovations with the need for robust oversight. Now, you might wonder, what can I do about this? It's empowering to know that as individuals we have a role to play. First, staying informed is key. Ask your doctor how your biometric information will be used and stored. Don't be afraid to question and seek clarification. Remember, it's your data, and you have the right to understand how it's handled. You can also advocate for stronger laws, engaging with policymakers, supporting advocacy groups, and participating in public discussions about biometric privacy are all ways to influence how regulations evolve, because we all recognize the importance of healthcare advancements, right? It's like knowing we're moving forward to better treatments and cures, but we need to stay in the loop with the rules and regulations too. They're like our safety net, making sure we're protected from any risks that might come along with these new advancements. As we look forward, the fusion of AI with biometric data paints a pretty fascinating yet cautious picture. Just like many fields, AI has this incredible potential to shake things up in how we handle biometric data, making everything quicker and more precise than ever. Just picture it, AI systems that can predict potential health issues you might face, all by just analyzing patterns in your biometric data. We might see these awesome biometric wearables popping up. They won't just track how many steps you've taken. They'll also be like little health wizards, predicting medical stuff in real time. Imagine having your own personal health assistant right on your wrist. But here's the thing. With great power comes great responsibility. Just like in those superhero movies, we've got to make sure that when we use AI, we're doing it ethically. That wraps up our discussion into the complex world of biometric data in healthcare. What do you think about the use of biometrics in medicine? Are the benefits worth the risks? Drop your thoughts in the comments below. We would love to hear your take on this. If you found today's discussion enlightening, give us a like, hit that subscribe button, and share this video to keep the conversation going. Thanks for watching. I find it interesting as time goes on, and as healthcare rapidly changes, you took the time to view the video. You have my sincere gratitude, thank you. Before I sign off, could I ask you to please like, comment, turn on notifications, and subscribe to Rapid Nurse? This will really help the channel get off life support and deliver a shot of adrenaline to the heart of the channel.